Scarring and plastic surgery, are patients concerned about scars?
Yeah, absolutely. That's one of the first things that they'll ask during the consultation is, what are my scars going to look like? Do you have pictures of your scars? And then after the surgery, patients are always interested in what they can do to help improve their scars. So in our practice in Boca, I'm with Dr. Pozner, we have a laser scar protocol where every patient that we operate on gets a series of fractional laser treatments. And then in addition, we've instituted a laser scar cream called Skinuva. And this solves a problem that we were having where patients would come and say, okay, in addition to the laser, what else can I do to help improve my scars?
I also have switched to Skinuva, but explain what's the difference between Skinuva and something you buy off the shelf at CVS?
So Skinuva starts with silicone and then adds science. It's a series of growth factors and peptides and molecules that help the scar heal. And what's more is they have evidence-based comparisons from no silicone to their product and then regular silicone to their product. And this is clearly superior.
Yeah, and so in fact, it's like they actually have a lot of studies, a lot of peer-reviewed studies, 5 scar studies, right? And then there's another one for their Bright product, which we'll talk about.
So for our colleagues, this is a product that you can sell in the office that's superior to other products, that has great science behind it, that generates a profit.
And Jason, what about patients, despite using the scar therapy program, which I think is just having a scar therapy program, regardless of what it is a great idea because patients are very concerned about it. Patients appreciate that you have a program to make their scars look as good as they can. But specifically, what if you have a bad scar? What do you do if a scar is not healing, it's hypertrophic?
So basically we have a protocol, as Jonathan said. We do fractional lasers. If they're red, we use BBL on them from Cyton that helps reduce the redness. But if they're a little thickened, I have no problem injecting the scars. Current regimen is Kenalog, 5-FU, and lidocaine, a third. And I'll use K10 or K40 depending on the scar. And we vary the fractional laser depths depending on how thick the scar is. And if it's a horrible scar, we cut it out and start again.
We have the protocol. We've been doing laser scars since 1996. And our protocol is after 1 month, we do laser once a month for 6 times. Right as soon as the wound is exposed, we put the scar cream on twice a day. And then if they are getting thicker, we'll do Kenalog or 5-F, that's the conversation with the patients. We're gonna watch your scar for the next 6 months and do everything we can. And there's something I wanna say about Skinuva also. So a lot of the other scar creams are just a scar cream and patients will ask, well, and then can I use a sunblock and all that? The nice thing about the Skinuva is they have different products and they have ones that have built-in SPF as well. There's one called Bright, and I had a patient that I saw last week. She had an abdominoplasty scar, Hispanic skin, and she was getting hyperpigmentation. She used the Bright for 30 days, and she just came in, and it was pretty much all cleared with the Bright, and I took photos before and after, so it's a very nice line.
Yeah, I mean, I think the Bright is a really interesting thing for us to talk about because number one, scar hyperpigmentation is something that we see, and there's not really a lot of good things that are out there now until Bright, which also has a peer-reviewed publication to support it. And in fact, the study on Bright is on melasma and post-inflammatory hyperpigmentation. So
we make scars for a living, and for many surgeons, their input into the scar ends when they leave the operating room. I think ours just starts at that. The key is to the laser, start as early as possible when the sutures are out, get involved with the patients. You will have better results and happier patients when you work on their scars post-op. As soon as we're done with the scar, a couple of weeks after surgery, we start with lasers, we use tape, we use bridgets, which help with the scar, we use all these creams. So we're actively working on your scars and we get beautiful scars using this protocol.
That's the great thing about this. I think you all have really highlighted, really the modern management of scar therapy and providing things for patients to make them feel better about their procedures. So remember, evidence-based scar therapy, I think what you've heard is the way that we're able to deliver really enhanced results to our patients now every day.